Okay, so for this video, I'm going to get more into practicing internal mindfulness skills, and this specific video is going to be about breathing. So I know probably a lot of you, okay, yeah, I've learned breathing techniques, but I'm going to explain in depth why deep breathing and how you should be deep breathing for, I guess, purposeful breathing, deliberate breathing. Oftentimes, when I encounter clients for the first time, I ask them, if they've been in therapy before, if they've learned about breathing exercises. Oftentimes they say yes, and I'll ask them how. And usually it's just, oh, well, you just take a deep breath, hold it for a couple seconds, let it out. That's the basics, but that's not what I'm talking about. And what I want to get into is the specific way you're supposed to breathe and why that is actually useful and helpful. So the technique that I'm talking about with regards to breathing is meant to stimulate the vagus nerve. So VAGUS, not like Las Vegas. You can remember it that way, but the vagus nerve, based on my understanding, is not part of your central nervous system. Your central nervous system, that's the nerves that run down your spine and branch out, and you feel tactile, the sensory input. You can move your fingers and toes and whatever. The vagus nerve starts at the base of your skull, at the base of your brain, and branches out into your face, through your neck, throat, down your chest, and it wraps around all the organs in your stomach. So in order to stimulate the vagus nerve, and there's a variety of different ways, and if you want to learn more about it, I would suggest go on to YouTube or whatever and look up stimulating the vagus nerve. But for this purpose, breathing, the proper way to breathe to stimulate the vagus nerve is you take a deep breath in, but you extend your stomach out, kind of like you're acting like you have a beer gut or you're pregnant or whatever. Just stick your stomach out first, and then fill your chest. As you exhale, exhaling out through the mouth, inhaling through the nose, exhale out through the mouth, you deflate the chest, and then you compress your stomach like you're trying to press your belly button to your spine. Just don't hurt yourself doing it. Don't do it too hard. You're just doing it enough to get your parasympathetic or rest and repair system online. And this can be very helpful with regards to reducing anxiety, distress. If your body's in fight, flight, or freeze, that is the whole purpose of stimulating the vagus nerve, is to force your body back to homeostasis. So once again, breathe in, and you can't see it right now, but you can put your hand over your stomach. Feel your stomach rise and fall as you breathe. So breathing in through the nose, feel it, hand rise, and then fill your chest, and then as you exhale, out through the mouth, deflate the chest, and then compress the stomach. Hold it for a couple seconds, and then repeat. You're going to have to repeat this over and over until you actually feel a shift. Usually they say that you probably shouldn't do it any less than a minute or minute and a half. For me, it's roughly 10 breaths. But my recommendation is do it until you feel the shift. And you should feel a sensation. You should feel, if you are in a state of distress, hopefully the distress levels will start to come down. If you're feeling anxious, you might notice a shift in your body. But that's also all part of like mindful breathing. So as you're doing this, I want you to be aware of how you're feeling in the moment. If you're in a distress, if you're anxious, or even if you're not, I would encourage you still practice if you're not. That way you have the tool I guess, within reach, I guess. If you do get into a state of distress, a lot of times everybody's toolbox goes out the window and they don't know what to do. So you have to practice this on a regular basis, even when you're not in distress, so that when you are in distress, you have something to fall back on. So, being mindful, breathing. Everybody does it every day. It's part of our staying alive, basically. So, being mindful as you breathe in, feel the rise of your belly, feel the air inflating your lungs, feel the air going through your nostrils and into your lungs. What does that feel like? Just notice what it feels like. Describe it. Sometimes, depending on the air, it might, if you're in a cold environment, it might feel cold going in. You might actually feel it in your eyes. Some people might actually feel a sensation in their head. Just notice whatever it is that you're feeling. So, as you breathe in, notice those feelings. Notice what it feels like to breathe in. Notice what it feels like to fully expand your lungs. As you hold your breath, notice what that feels like. Just notice that. As you exhale out through the mouth, what does it feel like to have the air flowing out of your mouth? What does it feel like to have your lungs deflating? What does it feel like to have your stomach compressed? And then hold that for a couple seconds and notice what that feels like. So as you're breathing in and out, you're noticing anything and everything with the breath in, hold, with the breath out, hold. So notice everything that you're feeling. Notice what your thoughts might be. Try to maintain a sense of focus on just your breath. The idea too is like just maintaining that focus will hopefully help you ground to the moment. It'll ground you to yourself. So there's different ways of, and there's also other different ways of stimulating the vagus nerve while you breathe. So not just the belly up and down, but also smiling, laughing, anything that stimulates the vagus nerve around your vocal cords. Oming, humming. I actually try to encourage clients on a regular basis, if you're feeling low levels of distress, hum a tune. If you have a favorite song, or even if you don't even have a song in your mind. I mean, I walk around at times and I just hum, just to maintain a sense of calmness, stability, I guess, just as regular maintenance. It is absolutely good to laugh on a regular basis if you can. Try to find something that will actually, I guess, stimulate your funny bone, so to speak. Find reasons to laugh. Whether it's watching a funny TV show, sitcom, look up stuff on YouTube, whatever, or any other video platform, things that might make you laugh. That can definitely help. Now, oming, this is something else, not just the vagus nerve. However, I want to express that, when you breathe in, and if you have any kind of like biofeedback, anything that can actually help you hear or see your heart rate, you'll see the effect. You'll see this effect. Naturally, as you breathe in, your heart rate and blood pressure increases. As you exhale, your heart rate and blood pressure decreases. I remember that kind of was unnerving at one point. I was in Psych 101 when I went back to school, and our teacher had us use biofeedback monitors that basically is just a handheld thing, similar to the dry erase thing, that basically had two little metal things, put your fingers on it, and it would have an audible sound for your heart beat, like beep, 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 beep. what I noticed was while I was holding it, my heart rate increased while I was breathing in, and it was decreasing while I was breathing out. First thought in my mind was, this is unsteady heart rate. And I was like, do I need to be worried about this? Do I need to go to the doctor? She was like, no, that's actually natural. That's kind of how our bodies work. So you can use this to your advantage. So keeping in mind, as you're breathing in, heart rate, heartbeat increase. As you breathe out, heartbeat, heart rate decrease. So if you feel like you're in such an anxious state, a level of anxiety, your heart rate is probably bump, just it's pounding. Your breathing is probably shallow. So if you do a breathing technique where it's a quick breath in and then a slow breath out, hopefully the idea is that you're encouraging your body to reduce the heart rate and reduce blood pressure. So what I've also found is that oming is an excellent technique in order to extend the exhale. So take a deep breath in. So just from that demonstration, just oming, creating that vocal, forces your body to slow the exhale even more than it would otherwise. Okay, so now to kind of get into the techniques, other techniques as far as like how to breathe. So these are the techniques, belly breathing, breathe in through this, extending your stomach, fill the chest, breathing in through the nose, exhale through the mouth, stimulating the vagus nerve. You can ha, or even I suggest look up laugh yoga. That's actually a great way, to kind of induce laughter. And you can do it, you can fake laugh and it will still have a very similar effect. It helps change the mood. Humming a tune and oming, especially oming. So there are various techniques that you can do. Box breathing is pretty much the first one that I tend to start people off. It's relatively easy. Basically the idea is, and I'm going to draw it here. So basically you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, hold for 4 seconds, breathe in for 4 seconds, and then you continue doing that. That's why they call it box breathing, because you're basically like drawing a box in the air as you do it. So that's an even number of time for breathing in, and even same time for holding it, same time for exhale. You can change it up. Do what you feel is comfortable for you. You can breathe in for 4 seconds, hold it for 2, breathe out for 4 seconds, hold it for 2. However long you feel is comfortable. So I'm just using those numbers as an example. If you don't have great lung capacity, you could be breathing in 2 seconds, hold it for 2 seconds, exhale for 2 seconds, hold it for 2 seconds. It's pretty much very similar. So that's box breathing. There's different ways of doing it. And then there's the physiological sigh, which is basically 2 quick breaths in and a long exhale. So basically it looks like So that's kind of the idea behind that. Again, with any breathing technique, Do it until you feel that shift, and even a little bit past, so that you know your body is coming back to homeostasis. You're turning off the fight, flight, or freeze and turning on the rest and repair systems. The physiological side is an excellent one for oming. The box breathing, not so much. I mean, if you're doing the same time breath in and exhaling the same time, you're probably not going to ohm, but you can ohm, but it's going to be quick. And you can extend it. It really doesn't matter, I don't think. You can breathe 4 seconds in and then ohm for 8 to 12 seconds, however long you feel like it needs or you need. Same thing with the physiological side. Just make sure you get those 2 quick breaths in, and then you can ohm. That'll extend out the exhale. Now, there's another breathing technique that I've been using on a regular basis that I found very helpful. It's called the Wim Hof method. I hope I'm pronouncing his name correctly. Basically, the idea is this is controlled hyperventilation, and it's basically 30 deep breaths in, so you're not pausing in between. It's just and still the same technique. Rising, extending your stomach, filling the lungs. As you exhale, you're deflating the lungs, compressing the stomach. I would recommend look up Wim Hof's website. You'll get a lot of information from that. He also has a guided tutorial session. I use that pretty much every day. I did come across the idea too, and I want to put this out there because there's a lot more to breathing techniques than just maintaining homeostasis. What I ended up discovering by using the Wim Hof method, his breathing technique specifically, is that it actually changes your blood chemistry. At least this is my knowledge. Don't quote me. I suggest do your own research to follow up on this. Changes your blood chemistry from acidic to alkaline. My understanding is that viruses like cold, flu, COVID, they thrive in an acidic environment as opposed to an alkaline environment. So if this breathing method, or it might actually be true for any breathing method, but I'm focused on this one because this is where I got information from with regards to this specific breathing method. It changes your blood chemistry from acidic to alkaline. So if you're doing this and you're maintaining an alkaline environment in your body, you have created an environment that is not conducive to allow viruses to take hold. I've been doing this for 4 years, since the pandemic started in 2020. I have not been sick for 4 years. I'm going on 4.5 years now. I have at times felt like I was getting sick, and I did. If you go onto Wim Hof's website, you'll see all the studies and research. They had him in the hospital, and based on their research, I'm not going to get into the details, but he fought off the symptoms of a virus that they put in him that created symptoms, but apparently he experienced really nothing more than a mild headache and fought it, and it went away. So I used that concept for myself. I did it when I started feeling like I was getting sick, like a cold, flu, COVID, I'm not sure what it was. On a regular basis, I do this every single morning when I wake up. It's energizing, it refreshes me. I do it every single night before I go to bed, and it actually does help me fall asleep. But when I start feeling sick, I increase the number of times. I'll do 3 rounds, like maybe 4 or 5 times during the day. And I can tell you right now, based on my experience, it worked. The symptoms that I felt coming on don't last more than a day, day and a half, if that, and then it goes away. So that's just something else to keep in mind. You know, the power of breathing in of itself has a physiological impact, and it can benefit you greatly. It's not just about decreasing stress and anxiety and all that stuff, which that's very important as well, and I'm going to get into another video about stress and anxiety. I'll kind of, I'll do that at a later time, but this is my encouragement to you, is to focus on your breath. Whatever breathing technique you choose to do, be mindful of how you are breathing. Be aware of what it feels like to breathe. That will actually help you ground yourself in the moment. So even in the former video where I was talking about external mindfulness, the 4 corners, 5, 4, 3, 2, 1, all that stuff, this is something that you can incorporate in with that. So even with deep breathing, use the 5, 4, 3, 2, 1. Well, I wouldn't say don't identify 5 things you can see or whatever, but just, you can't see your breath necessarily unless you're like out in the cold and you can actually see your breath coming out. But notice how it feels. How does breathing actually feel? How, as far as hearing, what does your breathing sound like? Key in on what your breathing sounds like. It sounds different breathing in as opposed to breathing out. Do you notice increased sensory as far as smelling? Do you notice increased sensory as far as taste? You probably can't taste your breath unless, of course, you ate something or something like that, and you can still taste the after effects. Every time you breathe out, you might actually be able to taste it. So just notice that as well. Okay, so that's pretty much the gist of it, the basics for breathing. I hope this is helpful for you. I hope I explained it in such a way that you consider this it's more than just breathing in and out. Most of us, I would say probably 99% of the time during the day, you're unconscious of breathing. Your body is just doing that automatically, and it will always do it automatically. I have actually, I joke around at times, and I've been around kids and heard of kids that threaten their parents. Well, I'm going to hold my breath until you give me what I want. Okay, go ahead, hold your breath. Let's see how that works. You're not going to die. If you hold your breath to the point where you pass out, when you pass out, your body is automatically going to start breathing again. It's just one of those automatic things. But it definitely helps even to be mindful of not just deep breathing, but take a moment to just sit and just pay attention to how you're breathing. What does your normal breath rate feel like? Is it shallow? Is it deep? How does it feel? Sometimes you might actually be breathing shallow enough that your body wants a deep breath, and you might actually, okay, yeah, where did that come from? Well, usually if your body is responding to needing a deep breath, you're probably not taking in as much oxygen as your body requires or needs or wants, and it's basically going to do it, and you may notice it, you may not notice it. I would encourage you to notice these things. Pay attention. Pay attention to yourself. Pay attention to how you're breathing, how it feels. Okay, that's it for this video. Go do some breathing exercises, see how you're feeling. I hope you have a wonderful day. I hope you have a wonderful life. Take care.